Good morning, students. Today we will discuss about the accessory nerve. Accessory nerve, it is 11th cranial nerve, motor nerve, and accessory to vagus. So name is accessory. This is the inferior view of the brain, and you can see this is the vagus nerve. Just below the vagus nerve, that is accessory nerve. It have two parts, cranial part or spinal part. The cranial part or the cranial root of accessory nerve lie just below the vagus nerve. This is the vagus nerve. And just below the cranial root of accessory nerve, that is the spinal root of accessory nerve. Now we will discuss about the cranial root. Functional components. The cranial root of accessory nerve, spatial visceral efferent fibers from the cranial root of accessory nerve arises from nucleus ambiguous. This is nucleus ambiguous. Uh, it is formed from the axon of nerve cells of lower part of nucleus ambiguous and runs lateral as a cranial root and reach the posterior cranial fossa. This red one is showing the cranial root and the green one is showing the spinal root of accessory nerve. Now, course of the cranial root. The cranial part of accessory nerve arises from the nucleus ambiguous. This is showing this marked area showing the nucleus ambiguous. 4 to 5 nerve rootlet to the side of the medulla. To the side of the medulla between olive and inferior cerebellar peduncle. Below the vagus. This is vagus. And then unite to form the cranial root and runs laterally to reach the jugular foramina. This runs upward laterally to reach the jugular foramina, and here it meets with the spinal root of accessory nerve. After passing through the jugular foramen, the cranial root again separate from the spinal root. This is cranial root. It merges with the spinal root within the foramen, but after the passing through the foramen, it separates from the spinal root and soon it joins the vagus nerve, inferior ganglion of the vagus nerve. This is superior ganglion which lie in the jugular foramen and this is the inferior ganglion. So it joins the inferior ganglion of vagus nerve. The fibers of the cranial root of accessory nerve, uh, it passes from pharyngeal and laryngeal plexus of the vagus nerve. This is vagus nerve, and through the pharyngeal and laryngeal plexus of the vagus, it contributes to innervation of the muscles of palate, except tensor palati, muscles of pharynx, except stylopharyngeus, and muscles of larynx, basically intrinsic muscle through the pharyngeal plexus. This is all about the cranial root. Now we will discuss about spinal root or spinal part. Functional components of the spinal part. General somatic efferent fibers arises from the spinal root of accessory nerve, which lie in the spinal nucleus of accessory nerve. The spinal nucleus of accessory nerve lie in the spinal cord and is formed from the axons of nerve cell in the spinal nucleus. You can see this is spinal nucleus and that is the spinal root of accessory nerve. Course of the spinal part. The spinal part of nerve arises from the spinal nucleus which lie in the spinal cord. It is formed by the union of number of rootlet. You can see here number of rootlet from C1 to C5 cervical segment of the spinal cord, and they lie lateral to the spinal cord and they unite and ascends to the from the vertebral canal. This is the spinal cord and that is the vertebral canal. So they unite and ascends through these canal lateral to the spinal cord. Then it enters in the cranial cavity because this is a foramen magnum here and that is the medulla oblongata. So it enters the cranial cavity through the foramen magnum. Now the spinal root then runs upward and laterally to reach the jugular foramen. This is the jugular foramen I have discussed before. It reaches to the jugular foramen and soon it merges with the cranial root of accessory nerve. Because this is a spinal root, it merges with the cranial root of accessory nerve. After the short distance and passing from the jugular foramen, it soon separates from the cranial root of the accessory nerve. And I have discussed before that the cranial root joins the inferior ganglion of the vagus nerve. This separates from the cranial root after the short distance from the foramen. This is the intracranial course. Here you can see in its intracranial course, it runs lateral in the posterior cranial fossa. Now the extracranial course, in the neck, it descends vertically. It descends vertically between the internal jugular vein and internal carotid artery and deep to the styloid process. This is styloid process. Then it runs downward and backward. You can see it runs downward and backward and superficial to the internal jugular vein. Here it lies superficial to the internal jugular vein, then and deep to the sternocleidomastoid muscle. Here it innervates the sternocleidomastoid muscle and then move across to the posterior triangle of the neck. Here, this is the trapezius muscle. It supplies the motor fiber to the trapezius muscle. In its parts of its course, deep surface of the trapezius, the nerve communicate with the C3 and C4 spinal nerve and ends by supplying the trapezius muscle. And this C3 and C4 fibers known as a proprioceptive fiber for trapezius. This is all about the spinal root of accessory nerve. This is the diagram which is showing the complete course of the accessory nerve. This blue one is showing the cranial root and the red one is showing the spinal root, and they both reach to the jugular foramina, and after passing through the jugular foramina, the cranial root joins the inferior ganglion of the vagus nerve, and here the spinal root descends downward and reach to the neck, and through its course it runs posterior triangle and supply the sternocleidomastoid and trapezius muscle in its course. So this is all about the cranial root and spinal root. Now accessory nerve pulsing, clinical applied. The accessory nerve is spinal part mostly. The nerve is tested as follow. First of all, the sternocleidomastoid muscle, how we test it. Ask the patient to turn his face against resistance. This is offered by your hand. In paralysis, the movement is weak on affected side due to the paralysis of sternocleidomastoid muscle. Trapezius muscle, how we test it. Put your hand on the right or left shoulder of the patient and ask him to elevate his shoulder or shrug the shoulder. In paralysis, the movement will be weak on one side due to the paralysis of trapezius muscle or vice versa. This is all about the accessory nerve.